In our special report, Addicted, medical professionals are not exempt from the opioid crisis.
Certainly not. And Addiction Campus's report finds that in 1 year, Tennessee, Mississippi, Arkansas, 14 different nurses lost their licenses to practice because of substance abuse. Fox 17 News' Kathleen Jacob in studio now after talking with a nurse who's been through that very thing.
Yeah, Scott, that number is actually 114. And the woman I talked to is working toward getting her license back now. She got to the point where she was stealing medication from the hospital, proving even the people most informed about this crisis are at risk.
Amanda Martin has had a tough few years that could knock anyone out. She lost a child, her husband deployed overseas, then she's diagnosed with lupus.
I was an RN and I was working full time, and so that's where my addiction began.
A labor and delivery nurse, she'd frequently come home with leftover vials of medicine in her pockets.
It's hard to get pain medicine because most doctors are fairly strict about that now. And so when you have that addiction, you know, being a nurse, it is right there and it is a temptation.
One day, it was a drug called Dilaudid.
Dilaudid is, they call it hospital heroin. It's 100 times stronger than morphine.
She eventually figured out she could easily sneak Dilaudid out of the medicine dispensing machines at the hospital.
I wasn't taking the medications from the patients, but, you know, and so my supervisor figured that out. She saw me and she knew that the patients I had were not on narcotics like that.
She eventually lost her license and ended up in jail, but she's not alone.
And I've met a lot of nurses that are in the recovering nurses program or are no longer nurses.
Addiction Campus's Brian Sullivan says many medical professionals delay getting treatment out of fear.
Admitting that you have an issue with something that could end your career like that could end everything that you've worked for your entire life. The pressure of that can be insurmountable.
He says they're constantly taking on other people's trauma, and it's easy to let their guard down and succumb to their own.
One of the things that we really need to work on doing is ending the stigma within the medical community.
And that's exactly what Amanda's working to do.
Getting rid of that stereotype and that stigma behind seeking treatment, you know, makes a huge difference.
Protecting the lives of medical professionals so they can continue caring for us.
Amanda has been sober for 2 years. She's currently working as a recovery coach and peer specialist for Turning Point. If you or someone you know needs help with addiction, we have resources on our website, fox17.com.